Welcome back. Congressional Democrats tried and failed to force Republicans and President Trump to agree to extend subsidies that help make health insurance more affordable for those that get it through Obamacare or the Affordable Care Act. Now Americans are left to figure out how they'll afford premiums that have gone up more than 100 or 200% in some cases. And this as Trump once again has promised to unveil a plan of his own. Joining us now is Bruce Japsen, a Chicago-based healthcare reporter for Forbes magazine. Bruce, good to see you again.
Good to see you.
Bruce, how much are premiums going up and how many people is this impacting now? And when are they going to see that impact?
Well, people are going through open enrollment right now. It started November 1st. It runs through mid-December, where they're going online to the healthcare.gov website, or in Illinois, they have Covered Illinois, and they're seeing these eye-popping premium increases because the subsidies, some people based on income, millions of people actually, get a subsidy. That was part of the individual coverage of Obamacare. Some people pay very little, some people pay hundreds, even thousands of dollars, or will next year, because these enhanced subsidies that allowed even more people to get cheaper health care were passed under the Biden years in 2021 and 2022. Those expire this year. And so people are going online, they're seeing these premiums, and it was, of course, one of the issues of the government shutdown, as the Democrats said, we got to extend these, or you're going to get socked with these huge premiums. And now they basically are, that's what they're talking about now. What the Trump administration is talking about is that they may extend them for 2 years, but there are some, they might tighten eligibility. They might say, you know, if you make over $100,000, or you might lower the income.
And we're talking about tens of millions of people here that get their coverage in.
Yeah,
and we're seeing, you know, huge hikes, 200%.
200%.
Thousands of dollars.
I'll give you an example from Kaiser Family Foundation. If subsidies are extended, and if you are age 60, you don't get Medicare until you're 65. If subsidies are extended, you're talking $460.
Okay.
If the subsidies expire, it's $1,380. That's like triple. That's like 300%. And so you have the situation where people are going on, and they might, one of the things that might be happening is they might say, you know what, I'm not going to get coverage. I can't afford it. I mean, if you're talking something going from $200 or $300 a month to $1,000 a month, you know, that's a lot of money.
It's a massive expense.
And that's just a small. I mean, some people are seeing, you know, much bigger. So there's the insurance, individual coverage under the Affordable Care Act, Obamacare. The enrollment, when these enhanced subsidies were passed into law, it ballooned to 24 million. So that's a lot of money, and healthcare costs are already going up next year for a variety of reasons.
Well, it seems like there's bipartisan support for these subsidies in the general public, maybe not necessarily in Congress. Republicans have resisted doing this, but they are facing some pressure from their own constituents.
For sure. The Kaiser Family Foundation, KFF, they did a survey that said that 57% of Republicans and MAGA supporters, I guess there's a difference, were for extending the subsidies. So when we expanded health care coverage under the Affordable Care Act, they did it two ways. They expanded Medicaid, so more people could get Medicaid, and then they created Obamacare. In 10 states, Republican, red states, if you will, they did not expand Medicaid. Well, those are states where they're buying Obamacare. So if they don't extend the subsidies, Trump is screwing his own voters here. And so
which is why you see the reporting indicating that he wants to extend the subsidies here. But apparently there was supposed to be a plan he was going to unveil. We heard this in his first term. It never came. Is that plan going to come this time? And what's it going to entail beyond extending those subsidies? Because he's talked about giving people just a couple $1,000s.
That's not going to, that's not going to work. They're basically, the framework is already there to do the tax credits, the subsidies, and so forth. I think they're probably trying to politically do something and expand them temporarily and call it something else. They haven't even released Obamacare signups, how many people are signing up. And so we're talking, if you compare this to, you know, the price of ground chuck going up $5 or $10 at Jewel, and then you're talking about people getting hit with health insurance costs that are going up $500, $1,000, these huge
Not
numbers.
to mention home insurance, car insurance, energy
Exactly.
prices. It seems like everything is just ballooning right now. But, the markets have reacted positively to the notion that the subsidies would increase. So it seems to be that the economy at large would benefit from,
Oh, for sure.
from this being extended.
Yeah, for sure. So if you have a lot of the health insurance companies are sort of whispering, they're saying, we think we're close to a deal. They obviously benefit by people buying their plans because people do pay for it. The government kicks in, the health insurance companies tend to always win, and so forth. But if you have more people, let's just say young people will be the first people that will say, you know what, I'm not buying this. I can't afford this. I got a cell phone bill, I got a car payment, I got whatever.
And I'm healthy.
And you're healthy. You need healthy people buying health insurance to pay into the pool because their premiums help pay the costs of the older and sick people. So if you just have sick people using the healthcare system, it's like whack-a-mole. The health insurance costs will go up next year for everybody. So that's the way health insurance works from the very beginning, is that you want to create a bigger pool. And in the last few years, to the credit of Obamacare and employer coverage and so forth, premiums have been relatively stable. I mean, they go up 5% a year and they say that's a victory. But this year, you have situations where 1 in 8 Americans are taking these GLP-1 drugs, Ozempic and so forth. That's causing healthcare costs to go up and a pent-up demand for healthcare when people didn't get treated during the pandemic.
Those drugs are extremely expensive on their own, aren't they? Even if they're covered?
Yeah, those drugs you're talking like, there's a lot of price breaks going in because there's so many companies selling them now, but you're talking a few $100s a month.
So how is this going to be resolved? I mean, are you anticipating an actual plan being put forth by Republicans?
I don't think it'll be a plan. I think they'll call it a plan, but I think what they'll do is they'll extend the tax credits, but they'll say something to the effect of, you know what, somebody making $100,000 a year doesn't get a subsidy, so maybe they will limit or they'll tighten eligibility on it and so forth. That's probably what's going to happen.
What does this do for other health plans, folks that get their plans through their employer, folks that are on Medicaid? Does this mean that all these costs are going to go up?
Well, the problem with that is, so if you had, let's just say you and your significant other, your wife, your boyfriend, girlfriend, you bought Obamacare, and your wife has coverage through her employer, and you didn't choose her coverage. I would think you would do that, but some people might not. Those open enrollment windows have passed. So people have already chosen or are choosing right now, I guess it's still November, some employer open enrollments. So I think you're going to have a situation where you might have people going uninsured. If they do not come to an agreement by the end of December, these people could be out of luck. I mean, the government could always extend the open enrollment period well into January. I would think they would do that to accommodate them. Insurance lobby is still pretty powerful in this country. And
yeah, how do they feel about all of this? I mean, few industries give more to politicians than insurers, pharmacists, medical industry, pharmaceutical companies.
Well, what's really strange that we've seen under this president is that big business is afraid of him. So with the last election or politically, if his disapproval keeps going up, maybe they'll be less afraid of him. But the insurance companies are loath to come out and attack Donald Trump. And so we'll see how that sort of plays out. I mean, I think, they're out there saying, hey, patients are going to get hurt. Millions of people are going to have costs that are going to go up. We expanded this coverage and so forth. One of the things that one company did, CVS owns Aetna, nation's third largest insurance company. They kind of saw the handwriting on the wall of this and said, you know what, we've got other issues with people not shopping at our retail stores. We're going to get out of the Obamacare business. So they said, we're not offering it. So that's 1 million people, not a big insurer for Obamacare. They're getting out. So you could have a situation where, if this is what it's going to be when Trump and the Republicans are, and what we saw in the first term is they're like, you know what, if the regulations are going to be screwed up, if they're going to not include subsidies, if they're going to be waffling and they're not going to have a plan and whatever, we're not going to deal with this anymore.
Yeah.
And so that we saw that in the first term.
So is there any recourse right now for the folks, I've seen them, you've seen them, that are signing up, they're enrolling, they're looking, oh my God, what do I do?
Well, they need to shop and be very careful what they end up buying. I mean, with insurance, the higher deductible, the lower the premium cost is, but then again, you don't have as many things covered. So, some people consult a broker. Pay very careful attention to all the plans. There's still a lot of good choices in Illinois and Chicago. I mean, Blue Cross Blue Shield of Illinois has several plans. There's a company called Oscar Health, Cigna. There are a lot of choices to look at. They're just going to have to shop a little bit.
You were bringing up an interesting point with more and more people working in the gig economy.
Yep.
That are self-employed, they have nowhere else to turn. I mean, we can't just say, go get a job with a big employer that'll give you health care.
Right, exactly. That's a big problem. And that's what happened during the pandemic is that, we have more people working from home. You do have companies that will say, hey, you know what? There are increasingly a number of companies that are saying, we're not going to provide these benefits, and so, go to the exchange and check it out for yourself. So it's a real problem. I think that they will come to agreement on something just because there's going to be political pressure from, as you say, companies. We've got midterm elections coming up. And
Democrats have wanted to make this an issue, and that was kind of what the shutdown was about,
sure.
Elevating this as an issue.
Yeah, they did very successfully, and people don't give President Biden a lot of credit, but he sort of set a trap because they had the enhanced subsidies expiring this year. So the Democrats set that up, and then the subsidies are expiring now, and headed into the midterms and so forth, this is going to be an issue.
It seems like the kind of thing our former House Speaker Mike Madigan would do, set these kinds of traps. All right, Bruce Japsen, healthcare reporter for Forbes magazine. Thank you so much.
Thanks for having me.
You bet. And when we come back, a Chicago rock star takes his show to the austere stage of the Lyric Opera of Chicago right after this.